Today we're here to talk about the problem of pathogenic gene fusions. Two of the most common types of genomic alterations found in tumors are point mutations and pathogenic gene fusions. First, let's consider point mutations. These are changes in DNA base pairs. Examples include KRAS, BRAF, and EGFR. Pathogenic gene fusions are a different type of alteration. These typically involve two different genes that join together to form an abnormal hybrid gene. Examples of fusions include ALK, NTRK, ROS1, MET, and NRG1. Pathogenic gene fusions are a contributing factor in 1 in 6 cancers, and they account for approximately 20% of cancer morbidity. A retrospective study of 72 patients reported a 6.6-month decrease in median progression-free survival among patients whose treatment was not matched to fusions confirmed by genomic testing. Now let's consider overall survival. One retrospective study analyzed the cases of 85 patients with gene fusions, most of whom had sarcoma or non-small cell lung cancer. The 59 patients treated with a targeted agent had a median overall survival of 19.6 months. The 26 patients who received non-targeted treatment had a median overall survival of only 9 months. One pathogenic gene fusion that is receiving attention recently is NRG1, which is a key signaling protein involved in proliferation and survival. Extracellular binding of NRG1 activates tightly regulated cell growth pathways, including PI3K, AKT, and mTOR. While the prevalence of NRG1 fusion-positive tumors is low when considering a broad range of malignancies, they occur more frequently in certain cancer types, such as lung, pancreatic, breast, and colorectal. For example, in lung cancer overall, tumors are NRG1 positive in 0.3% to 1.7% of patients. But for invasive mucinous adenocarcinoma, 27% to 31% are NRG1 positive. Additionally, non-small cell lung cancer that is negative for other driver mutations may be NRG1 positive. NRG1 positive cancers are reported to be aggressive and associated with poor outcomes. And in pancreatic cancer overall, tumors are NRG1 positive in 0.5% to 1.8% of patients. But for KRAS wild-type pancreatic cancer, up to 6% are NRG1 positive. These NRG1 positive tumors have been reported to have a much higher rate of metastasis at the time of diagnosis, 67% compared with 32% for KRAS positive tumors. In addition, studies have demonstrated that NRG1 positive tumors show an increased rate of growth, invasiveness, recurrence, and resistance to standard therapies. NRG1 positive tumors have been reported to be 10 times more likely to have concurrent intra- and extrathoracic metastases than KRAS positive tumors, 50% versus 5% respectively. In a retrospective global registry study of 110 patients, NRG1 positive non-small cell lung cancer was associated with limited response to standard of care, as measured by overall response rates and median progression-free survival. Pathogenic gene fusions are strong oncogenic drivers that are involved in more cancers than we've previously realized. NRG1 in particular is a dangerous fusion that is emerging as a possible target.